When illness strikes, we look to doctors to give us answers. But what if they can't? For these unlucky patients, diagnosis is a mystery. August of 2005, Meredith Estes has just turned 19. She's getting ready to leave home for her freshman year of college.
The summer before going to school, it was exciting because I was working, traveling a lot with my family, and then kind of spending as much time as I could with my friends because it was like our last summer together.
It was a time of transition because she knew that she was moving from one part of her life into another part. So a lot was happening, and as a parent, it was kind of bittersweet.
But amidst the excitement of packing and preparing, Meredith begins to complain of a sore throat.
I thought it probably wouldn't be that big of a deal because I had been kind of going out a lot, so I was like, oh, maybe I'm just kind of feeling under the weather because of that. And I think my friends, they weren't feeling the best either.
But as her friends begin to get better, Meredith's sore throat lingers. Eventually, she goes to see her family doctor.
And she basically told me that what I had was most likely just like some sort of virus or something going around, that best I could do, just kind of relax.
Meredith bides her time, assuming the sickness will pass. But it doesn't.
She continued to complain of a sore throat. She indicated that she had headaches. Also, sleeping a little bit more often than usual. Meredith doesn't require much sleep.
I started waking up. I'd be like in a hot sweat. At that time, my mouth, it was getting hard to open. So I would just kind of sit there and just be like, what is wrong with me? Why do I feel so sick?
A concerned Christy schedules another appointment at the pediatrician on September 2nd, the day before Meredith is due to leave for school.
I was leaving on Saturday, so the Friday, my last Friday, back in St. Paul, I went to the doctor again. They tested me for mono and they tested me for strep throat, and both of the tests came out negative.
Despite being sick for a week, the negative test results leave her feeling reassured. Meredith then directs her attention to getting all the last-minute details in place before the big move.
Meredith likes to make lots of lists. I noticed that she had made a list for some of the things that she was supposed to do for college, and I think number 6 or 7 was get better.
But when the day to drop Meredith off at school finally arrives, she can barely get herself out of bed. She manages to make it through the 2-hour ride to campus, but over her first few days at school, Meredith's health continues to deteriorate.
My tonsils were still bothering me, and not only were they enlarged, but like the left side of my face was getting kind of swollen too. I still couldn't open my mouth.
Her energy level was a lot lower. She didn't really want to go out, or she couldn't. She was sleeping a lot, and she wasn't eating very much, so she wasn't her normal self.
I remember waking up Saturday night in the middle of the night, still not feeling good. I think I had like a fever, and I remember like throwing up just in the middle of the room.
When I called her on Sunday, again, she said she wasn't feeling well. She hadn't done many of the social activities at school.
An alarmed Christy decides to take action and calls the local children's hospital hotline.
It wasn't long before the nurse went off the line and spoke to the doctor and got back on and said, your daughter is showing symptoms of a peritonsillar abscess, and she should be seen by an emergency room within the next 2 hours.
A peritonsillar abscess is an infected collection of pus that forms alongside the tonsils. If untreated, the infection can spread throughout the throat and obstruct the airway. Christy calls Meredith right away.
My mom was like, all right, I think you should go to the emergency room because you need to get this figured out.
At the ER, the doctor administers a strep test and conducts 2 CT scans to check for a peritonsillar abscess, but all the results are negative.
When I spoke to the emergency room doctor, he said he did not have a peritonsillar abscess. I felt a little bit reassured, yet I still felt worried. I mean, this was opening weekend of college, and here I had a child that had just been to the emergency room.
Meredith is diagnosed with tonsillitis and sent home with an antibiotic.
They're like, oh, you know what, you might not feel it, but after about a day or 2, it's gonna kick in and you're gonna start to get better. I went to bed hoping that everything's gonna be just fine.
But the next morning, the first day of classes, Meredith feels worse and has developed an alarming new symptom.
That's when my memory started to disappear, like my short term and my long term. My memory was just kind of like fading away.
When classes started, Meredith would get really confused trying to go to class.
I remember that day I had carried a piece of paper around with me, like marking down where I would go. Like I would like walk straight down the hall, then at this point take a left, and then walk through some people, and then take a right.
She couldn't figure it out, and she would stop and ask random people if they could help her get to her class, which isn't something she would normally do.
Then Ashley notices something else.
Her head was actually, it looked deformed. And I realized that she just seemed really out of it, really spacey. And then when I started making all the connections that she wasn't remembering things either, that's when I called Christy.
Not only was I worried about Meredith, but her friends were worried, and she was not herself. I called Student Health Services. I gave them a brief summary, and they were probably thinking, oh, this is a mother that's just a little bit overly concerned, but they were willing to see Meredith the first thing the next morning. I called Ashley and made arrangements so Ashley could go with her.
And then the doctor actually had me come in the room with them, and she did a couple tests. Then she left, and our friend Maggie actually called, and I told Meredith, I said, Maggie says hi and she hopes you feel better. And Meredith kind of gave me a really confused look and was like, well, who's Maggie? And that's when I got really upset, and I knew that something was really, really wrong, because Maggie was one of Meredith's best friends.
"19-year-old Meredith Estes is in her campus health center waiting for the results of blood tests. Just 9 days ago, she was perfectly healthy. Now she is suffering from an aggressive sore throat, delirium, and appears to have a swelling in the front part of her head.
It just looked like the top half of the left side of her face was bigger than the rest.
Meredith's mother, Christy, anxiously waits by the phone for the results of the blood work.
I got a call immediately saying that Meredith had low potassium levels, that she had a very high white blood cell count, and that she had a worrisome swollen left temporal area, and that she was making arrangements to have Meredith transported immediately to one of the emergency rooms in town. I grabbed a few things, and I was on my way.
When Meredith arrives at the ER, doctors discover she has developed a peritonsillar abscess after all. The only treatment is surgical drainage.
I remember them like having to cut like the back of my throat. They were trying to see if they could drain anything out, and they started doing it, and like it was bleeding a lot, and I remember crying because it hurt so bad.
A very apprehensive Christy is on the 2-hour drive to Duluth when she receives a phone call.
I picked up my cell phone. It was the ear, nose, and throat doctor, and he said, we have just drained Meredith's peritonsillar abscess. I felt a little bit relieved because I thought, oh, well, she did have a peritonsillar abscess now, and it's drained, and maybe now she can start getting better.
After draining the abscess, the doctors quickly move to determine the cause of Meredith's swollen forehead. They order a CAT scan of her brain and call in neurosurgeon Stefan Kanasevich to consult.
When I first met Meredith, I saw that she had a lot of facial swelling. She had a lot of word-finding difficulty. She had trouble remembering a few phrases. She had a tremendous amount of pain in and around her head. She had not only speech deficits, but was having some problems with her vision. Whenever somebody encounters somebody who becomes so sick in such a short period of time as Meredith, as neurosurgeons, we know that unless we act quickly, devastation may occur.
The CAT scans soon come back with grim results. Meredith has an abnormality in the left temporal portion of her brain.
The most likely diagnosis was that of a brain abscess located in the left temporal lobe.
A brain abscess occurs when an organism, such as a bacteria or fungus, infects the brain. Normally, an abscess can be treated with antibiotics and, in more developed cases, surgery. If left untreated, the intracranial pressure caused by the mass can lead to death.
They're common occasionally in people who are immunocompromised. We rarely see patients, such as Meredith, who are young and healthy adults.
Christy is almost to Duluth when she receives a second call.
And the call began, Mrs. Estes, this is Dr. Stefan Konasevich. I'm a neurosurgeon. And when I heard the word neurosurgeon, I just felt my heart sink, because in the next breath he said, your daughter is being prepped for brain surgery. I don't know what allowed me to continue to drive rather than going into the ditch, but it was just a real sense of, this is unbelievable. We dropped Meredith off, it was on a Saturday, and by that next Thursday I was on my way to see her in the emergency room.
Within 30 minutes, I had Meredith ready to undergo stereotactic aspiration of the brain abscess.
In order to see the brain in 3 dimensions, a metal device called a stereotactic frame is attached to Meredith's head at 4 points. Meredith is then put through a CAT scan, where the frame provides the fixed external reference point for the internal images shown on the scan. With both the interior and exterior of Meredith's head visualized at the same time, the precise location of the abscess can be identified, and Dr. Konasevich can devise a plan of attack.
With the CAT scan and the frame in place, we are able to identify the best target entry for entering that brain abscess to minimize the type of surgery the patient has, and also to be as very accurate as possible.
Dr. Konasevich successfully drains a large amount of pus from Meredith's brain. But Meredith is still in danger of having a relapse if the doctors can't determine what's causing the abscess and treat it.
I had contacted the infectious disease doctor, Dr. Linda Vanetta, who I had asked to look carefully at the microorganisms and or bugs that were potentially causing this abscess in the brain.
Usually a brain abscess is due to one or more bacteria. We will look at what the reason why the patient might have one, pending our culture results.
Dr. Vanetta rushes to the microbiology lab to study the sample Dr. Konasevich has extracted from Meredith's brain. Soon after, Meredith emerges from surgery.
I remember seeing my mom and seeing a friend and waking up and I just remember being so confused as to what was going on and what had just happened.
When I first saw Meredith, there was a real sense of relief, I guess, because I was physically seeing my child finally after having her endure all these things. Her eyes were not quite in sync, that there was also some droopiness with her eye.
For the next 24 hours, Meredith is closely monitored.
Aspiration can lead to effective cure along with the antibiotics. I was very hopeful that it would be able to do that in Meredith's case.
But Dr. Konasevich won't know for sure if he has to do another surgery until he sees how Meredith is responding to treatment. For the time being, it's a waiting game.
I was feeling a little bit better, a little bit more with it, but not full. There was still something wrong with me. I was still progressively, it was kind of standing still, but not getting any better.
Meredith had a very good Sunday. She had a visit from her sister and brother and father, so that was a very good meeting. But on Monday morning, we were greeted with a visit from Dr. Konasevich.
Meredith started complaining of increased headache and still had some word-finding difficulty. A repeat CAT scan at that time showed expansion of the abscess and evidence of increased swelling of the brain. So the next step for Meredith at this point meant undergoing a left craniotomy.
A craniotomy involves removing a portion of the skull bone and operating on the brain tissue beneath. The bone is replaced at the end of the surgery. It's a risky procedure and can result in seizures, brain damage, and even death.
Well, Meredith was very brave and courageous, but she did say to me several times, "Mommy, I'm really scared." And I assured her that she had every right to be scared and that I was scared too. And to hear that your child is scared is just a very difficult thing when you're just so scared yourself.
2 weeks weeks ago, Meredith Estes was healthy and excitedly planning for her freshman year of college. Now, she's about to undergo her second brain surgery in 5 days.
I think that when your child has to undergo brain surgery, you just wonder all sorts of things, if they're going to be ever the same.
At 8 a.m. on Tuesday, neurosurgeon Stefan Konasevich makes his first incision.
The abnormal portion of the brain in Meredith appeared to be discolored. Also, there had been evidence of some underlying pus that had emanated from that part of the brain. I was able to excise the majority, if not all, of the abnormal appearing brain. After having done this, I was able to close back the covering of the brain and put back the skull and sew back the scalp.
I waited for her to come out of it.
I just remember feeling a lot better and feeling almost like there was like a load off my shoulders. Like I just felt like I was me again.
And she wanted 3 things. She wanted apple juice, she wanted water, and she wanted chocolate milk. And very adamant in her delivery of those demands, I knew that I think I was getting my child back.
But Meredith is far from out of the woods.
Meredith was still monitored very closely in the intensive care unit. We continued giving her medications to prevent effects from the craniotomy, such as anti-seizure medication. We continued giving her anti-swelling medication. We continued monitoring very closely for her neurological status.
There was still an underlying concern because Dr. Konasevich conveyed that this bacteria may still be there, and there would be follow-up tests and MRIs done to gauge whether the bacteria growth was enlarging or whether it was fading away.
Meredith steadily recovers, but the family is still very concerned about the mysterious cause of Meredith's symptoms and terrified they will return. Finally, on October 3rd, a month since all of this began, the results of the culture arrive.
It was 3 or 4 days later when we had the final cultures back with Fusobacterium. Fusobacterium is what we call an obligate anaerobe. It's a bacteria that only can grow without the presence of oxygen. That's why Fusobacterium tends to be in abscesses.
Based on the presence of the Fusobacterium, Dr. Vanetta is able to give a name to Meredith's malady.
She had Lemierre's disease.
Lemierre's disease is a complication of a severe sore throat caused by a particular kind of bacteria called Fusobacterium. It occurs when the Fusobacterium cells that cause the initial sore throat spread to form a blood clot in the jugular vein. Pieces of the clot then break off, infect the blood, and travel through the bloodstream to form abscesses in other parts of the body.
Pus can metastasize through the veins and can go to the brain, can go to the lungs, can go to basically any part of the body and cause this metastatic sites of infection. And that's how Meredith's infection spread.
Fusobacterium can be found in most people's gastrointestinal and oral tracts and is usually harmless. But for an unlucky few, the bacterium can cause a life-threatening infection.
Fusobacterium is a very rare infection to have. It's reported and felt to occur less than in 1 in a million patients. And if untreated, her risk of dying in a matter of a few days would have been very great.
They told me that it had affected my temporal lobe, which affected my memory, which explained a lot.
Because it can easily be treated with antibiotics, like polio, Lemierre's is considered a disease of the past. Many doctors have never even heard of it, making it difficult to diagnose.
Lemierre syndrome is kind of called the forgotten disease because of the fact that it used to occur fairly frequently prior to the days that we had very effective antibiotics.
But the rise in Lemierre's cases in recent years is troubling to many infectious disease doctors.
Because there is this emerging concern in the United States that we are overusing antibiotics, we have been encouraging our physicians in the United States to not use antibiotics in a needless situation. And I think it's because we have stopped using antibiotics so freely in the setting of a sore throat. We are starting to see more cases of Lemierre syndrome emerging now in the last decade.
Once the bacterium is identified, Dr. Vanetta immediately designs a treatment regimen for Meredith.
She received 6 weeks of intravenous and oral antibiotic treatment.
They put a catheter in to my side, and every day I would have to insert 4 different liquids in it. And I told my friends about that, and they're like, oh man, that really sucks. And I was like, well, no, it's not that big of a deal. Like, after all else of what I had gone through, like, it was like the smallest thing.
By the next fall, having completed the antibiotic regimen, she's fully recovered and ready to start her sophomore year right.
Meredith is great today. She is a university student, doing well in her studies, and has a very spunky nature to her. She does not complain of any headaches. She doesn't have any visual problems. Her speech is intact. Her memory is also very good.
You can't tell that she had brain surgery at all. She's a really good student. She's still really energetic and optimistic and fun to hang out with.
Well, Meredith today is just amazing. I really admire her courage, her determination, her resiliency. I think she's made a remarkable recovery, and I think that she's really come a long ways from those dark days in the hospital.
After having Lemierre's, it seems like little activities that one takes for granted, like, I appreciate a little bit more because I'm able to appreciate them. Like, I'm able to do maybe what some people that had it aren't able to do because they're no longer around.
Meredith was hit so fast and hard with her symptoms, she didn't know what was happening to her.